I'm Dr. Roy Barsness, author of the text Core Competencies in Relational Psychoanalysis, a guide to practice, study, and research, and founder and executive director of the Contemporary Psychodynamic Institute, who is the sponsor of these interviews. In the first episode of this series, I spoke of the research behind the compilation of the text that resulted in the discovery of 7 core competencies reflective in the practices of relational psychoanalysis. Those competencies, or what I would prefer to call them disciplines, are number 1, therapeutic intent, number 2, therapeutic stance, number 3, deep listening, affective attunement, number 4, the there and then and the here and now, number 5, patterning and linking, number 6, repetition and working through, and number 7, courageous speech, discipline, spontaneity. A separate and overarching core category was that of love. I then recruited various relational psychoanalytic writers to write about each of these disciplines, and I'm now interviewing each of them for this series. So welcome to today's episode featuring psychoanalyst and author Dr. Jessica Benjamin, who is speaking on behalf of the late Dr. Lou Aron, who contributed to the 4th chapter, Relational Dynamic, the There and Then, and the Here and Now. Dr. Aron and Dr. Benjamin were very close colleagues and founders of the relational psychoanalytic movement. And this essay he wrote for this book heavily references his work with Jessica. Before we get into this essay, Jessica, I'm wondering if you could say a few words about Lou, his life, his work, and your influence upon each other.
Well, just to introduce my relationship with Lou, Roy, I met Lou in 1980 when we both started training at the New York University postdoctoral program in psychotherapy and psychoanalysis. And Lou was, right from the beginning, just the most eager, the most keen to get going. He couldn't wait. And that was his attitude all the way through, sort of his attitude in life. Let's go. So his enthusiasm was, a factor in everything that he did and everything that we did together. Lou's ebullient, enthusiastic, generous nature really colored everything that he did. And at the same time, there was, it was immediately clear and just became ever clearer how incredibly capacious Lou's mind was, how extraordinary his ability to absorb, one text after another, one theory after another, one mode of working after another. He sort of reminded me of the robot in the Batteries Not Included film that I saw back then with my kids, where he goes into a bookstore and he starts yelling, "Input, input." he's like going through all the books. So that's my metaphor for what Lou could be like. And at the same time, he was a very, very aware, tuned in colleague, somebody who you could really cooperate with, think together with, always encouraging everyone. So I can't say enough about how important he was in so many ways. But now, this particular piece of work that he's presenting did start, as he indicates, with our working together on a 1999 presentation for Division 39 on the idea of the third. And for reasons I can't fully remember now, we had gotten to talking about how this concept could be changed into a relational concept. Now, as you probably know, Lou's early work was all around taking traditional Freudian concepts and translating them, for instance, working through, or countertransference, or he also did one on dreams. So he had, and then his big opus around that was reformulating the primal scene idea, yes, which comes up here too. So now he and I are getting together on this project because people like Britain among the Kleinians and the Lacanians, and various people are now, especially Ogden, talking about the third. What do we think about that? We say to each other, well, actually, it's too much about what's going on in the analyst's mind. It's not intersubjective enough. We agree. So from there, each of us began to contribute what we saw as the intersubjective idea of the third. And as you will note, for Lou, it heavily involves the idea of observation and reflectiveness, reflexivity. For me, it's a little different. So our emphases were different, and we brought them together in that first presentation.
Thank you for that. And I know when we've talked a couple of times before, a lot of emotion comes up when you are reminded of Lou, and I know I'm touched by that you have a deep relationship in many forms with him. I only was able to meet him twice, but in our very first meeting, it was very much like we were going to be friends. There was a electricness there, and he was so open and generous with his mind and heart, and inviting me to kind of be the same. And it was quite honoring and humbling to me that he was very enthused about my research for this book, and was the push behind getting it published through Routledge. So I miss him and feel as though we all missed out on a great opportunity to keep that mind alive within our field, and not having him actively still contributing to the richness of relational psychoanalysis. And I'm very grateful to you, Jessica, for representing his work. I don't think anybody could have done it other than you, frankly. So thank you for taking the time and doing this. And I would like to introduce you all to Jessica, who is an analyst and makes major contributions to psychoanalysis and social thought. She's practicing in New York City, where she's on the faculty of New York University postdoctoral psychology program in psychoanalysis and psychotherapy, and the Stephen Minchell Center for Relational Studies. She's as I said earlier, one of the original founders, contributors to the field of relational psychoanalysis back in 1980, and studying with Lou on the theories of intersubjectivity, gender studies, feminism, and as it relates to psychoanalysis and society. And she's known for her ideas about recognition in both human development and in the socio-political arena. And Jessica, I want to say that the last chapter in your book, Do and Done Too, on the whole socio-political situation in Israel and Palestine is very, very moving. It's a very moving chapter. And I would encourage all of our listeners to make sure you have that book in its fullness, and her contributions into how we think politically and within a culture. I just think it's great. In addition to all of her numerous articles, she's written A Desire of One's Own, Psychoanalytic Feminism and Intersubjective Space, The Bonds of Love, Psychoanalysis, Feminism and the Problem of Domination, Like Subjects, Love Objects, Essays on Recognition and Sexual Difference, Shadow of the Other, Intersubjectivity and Gender in Psychoanalysis, and most recently, Beyond Doer and Done Too, Recognition Theory, Intersubjectivity, and the Third. I've always long been a reader of Jessica Benjamin, and she's had a huge impact on my own practice, as well as on my students, as well as on the New Institute, Contemporary Psychodynamic Institute. So very, very grateful that you're here, Jessica. In my introduction to this chapter, I write, actually there's a quote I'd first like to say from Eduardo Galeano. He says this: "No history is mute. No matter how much they own it, break it, and lie about it, human history refuses to shut its mouth. Despite deafness and ignorance, the time that was continues to tick inside the time that is." And psychoanalysis gets this, and has historically gotten it, that the past just has to repeat itself over and over and over until someone gets it, engages it, and works it through. And so the important part in this chapter with Lou Aron, he takes the reader beyond the historical binaries of transference and countertransference, And he introduces intersubjective theory that Jessica is also a part of that major contribution, and offers the concept of the analytic third. Working within the subjective field shifts the emphasis of the treatment away from interpretation as the primary means for change to working through the inevitable impasses, enactments, and divides inherent in a co-constructed therapeutic relationship. Before we get into the interview, one of the things that I included in the book was direct quotes from relational analysts that were part of the research study. I just want to share these properties that showed up with you, and they are these. The properties of relational dynamic, there and then, here and now, is we tend to pass experience to there and then that is played out in the present. So we do attend to early attachment, developmental history, defensive structures in both the patient and the analyst, projection, which has been rethought in terms of intersubjectivity, but in both patient and therapist, replication, style, intersubjectivity again, culture, trauma. And we attend to these in the here and now, engage the patient in direct relationship with the analyst, believing that the most powerful work is what emerges between the analytic dyad. Attend to what happened in the past as it's happening within the dyad. Pursue the question of what is going on here in the in-between. Attend to how the analytic dyad is impacting and influencing one another, encouraging the patient to be curious about the analyst and attempts to avoid the temptation to solve. So thank you for joining me today. And let's just jump in, Jessica, and refer to your book, Beyond Doer and Done Too, Recognition Theory, Subjectivity, and the Third. And I can imagine you and Lou had many conversations together on those. And so let's talk about each of them, and let's begin with complementarity. And to be clear, it's what this brings us to, and the first article around this that you actually wrote in 1988 was in the Bonds of, no, it was an article, that's right, yeah.
What was the book?
Oh, it was in the book, okay.
The article was published in 1980, believe it or
80.
not.
Oh, wow, good for you.
Yeah,
You were just a kid.
I was coming right off of working with de Beauvoir's work, actually.
Wow, good for you. Wow.
So, yeah.
That just tells us how rich your mind is, I have to say. So I was still growing mine at that time, but came up with this idea of complementarity. It's getting stuck in binaries and splitting. And you refer this to as doer and done too, conflicts that occur not only intracyclically, but interpersonally and directly within the dyad. It is inevitable that human relations get trapped in the binaries of dominate or be dominated, terrorize or be terrorized, kill or be killed. You can really see how Jessica's mind here already is thinking beyond the clinical situation, because this is our culture, right? There's always a either or, a do or done to, and only one can live. And we're in an either or bondage almost, I would say. So could you just talk about this? Talk to us about complementarity.
Okay, so yeah, I think what was happening was that in the 1970s, I was reading object relations theory, I was reading Klein, and this, started to work through my mind. And at some point, probably, as I said, partly working through the thinking of de Beauvoir, but I came up with this understanding that what Klein was describing as splitting actually was embodied in two partners, and that you could either have splitting into complementarity where we each play one part, or you could have a kind of mutual recognition that each of us has those two sides within us. And so that was kind of the core insight, you could say. And very quickly, though, because I was also studying infancy research at the time, and I was actually working with Beatrice Beebe in her lab, I started to get, and also I have to say I had met Dan Stern, and I was very appreciative and involved with his work as well. So studying infancy, mother-infant interaction, I began to want to see this as something that you could trace all the way back. You could see developmentally how, shall we say, this binary of controlling or be controlled, either I control you or you control me, was what I guess Kohut would have called a breakdown product of what should be the recognition in the first face-to-face play. In other words, we should be mutually accommodating, we should be getting into a rhythm, and rhythm was an idea developed by Sander that became important for me later. Instead of having that kind of give and take rhythm and that mutual accommodation, you start to see control happening. Shall we say, mother's anxiety creating control, infant feeling that they can't control the stimulus that's coming at them. So the issue of affect regulation that was to become so important later wasn't really articulated at that time. But what was articulated was this need for, shall we say, recognition versus relations of control. And the idea of the split complementarity that developed out of that had to do with the notion that, of course, through projection, something gets offloaded. For instance, the man offloads vulnerability, helplessness onto the woman. Man cannot tolerate dependency on woman. Man projects dependency onto woman. In reality, man, qua baby, is born of woman, as de Beauvoir said, and so that became then the idea of woman born by Adrienne Rich. Men are of women born, they revolt against that. This was an early feminist idea. So you could already see the idea of splitting in this early feminist understanding, also in de Beauvoir's ideas of binaries as being split between men and women.
Yeah.
Men are seen as reason, women are seen as emotion. Men are objective, women are subjective, and so forth. So de Beauvoir was the first to analyze the idea of the binary oppositions being split along gender lines. And you could see how that then, when you put that together with Klein's idea of splitting, you could begin to create this sense of what I call the gender polarity, that form of splitting, but also other forms of splitting between people. And then if you've ever been in any dyad of any significance, you know how this works.
Right. And what I'm hearing you saying is that when you moved to complementarity, that it was not only the patient splitting, right?
Well, what I was later, when I began to develop this more clinically, what I came to understand, of course, was that initially, the way you experience it as a therapist is you feel drawn into the patient's complementarity.
Yeah.
You don't want to be that person that they want you to be. I mean, let's be clear about this. A lot of the time, we're actually aware that we are, in a sense, being drawn into someone else's complementarity. It's not exactly the same as our own complementarity. If we were the patient, we'd be drawing them into something different. But we know what complementarity is. We know what it's like to be drawn into or draw someone into that. And so what the dyadic structure, as Lou expounds very clearly, stays the same while we switch positions. So in some relationships, we really have the seesaw where one is up and then another is down and up and so forth. Some relationships are more rigid, but we still have this constant either up or down. So the example that I then, or I should say the dynamic that I identified as being so crucial in the therapy dyad is the dynamic of blame.
Yes.
The dynamic of who is to blame for what happened or who is to blame for what happened to me. So one moment I'm talking about how my mother was to blame for what happened to me. The next moment, it's really the therapist who's acting like my mother. And as I was described, the problem becomes for the patient in such instances, I've really had the bad luck to find a therapist who's just like my mother,
Right.
or who's judging me just like my father, right? So that when we are in that concrete state, it doesn't seem as though we're projecting. That's the crucial
Right.
point, because we each embody that thing. Now, the therapist who feels accused of having hurt the patient by becoming that which the patient fears is going to be is going to feel, in actuality, they are being hurt, or because the patient is accusing them of not being a good therapist, right?
Right. Yeah.
So that fundamental dynamic was what I was trying to identify.
Yeah.
And the sense of being accused and blamed, then that's the symmetry. We both feel blamed.
Yeah. Yeah. This might be a good place for you to talk about the one and the third and the third and the one.
Well, we have to backtrack for that.
Okay, let's backtrack.
Let me backtrack a little. Okay, so let's go back to in Lou's thinking, the third, and the way we get out of this impasse and the way we get off of this straight line where we're either up or down is through this triangular space. And he talks about what contributes to triangular space, which is very useful. But one of the things that he talks about in that creation of triangular space has to do with, shall we say, the reflexivity of being able to hold two positions at once, to think about the fact that I'm a blamer and I'm also being blamed at the same time, for instance.
Yeah.
So that ability is what Lou is very much focusing on as creating the third. And he traces that back developmentally in a way to the Oedipal triangle, where we should learn, in his view, to be able to identify with both parents. Now, what I did, and he mentions this, is to take this back into the pre-Oedipal and into infant development, right? So among other things, we can see that triangular movement for infants, when you look at face-to-face play with both parents present, you'll see, I've seen this in the park, you'll see an infant in the carriage looking at both parents. And at one moment, one parent is leaning in and interacting, the other one is watching. The infant and the parents will somehow switch simultaneously. And now the infant is looking at the other parent and interacting with them, and the second parent is the observer. So infants are already capable of doing this at the age where they're doing face-to-face play. It's quite remarkable. Now, therefore, I'm interested in how this works out procedurally. Procedurally meaning the nonverbal interaction. So I start with infancy, and I say that there is this rhythmic third, as I now call it, what I used to call the one and the third, which Lou explains very nicely as being that element of union and harmony that we experience within the third space, let's say. But I changed it to the rhythmic third because really that concept of rhythmicity kind of encompasses what we mean by mutual accommodation, what we mean by the nonverbal, and it's a slightly musical metaphor that allows us to think about the nonverbal and allows us to think about, for instance, the gestural interaction whereby we do give and take, let's say.
Yep.
So we see that in infancy. I called that the rhythmic third. Later, but initially I called it the one and the third because it has to do with synchrony.
Yeah.
Right? So we synchronize. And that's what I was saying. The infant can synchronize with two parents, not just one.
Yeah.
So for that reason, we argue that the infant is capable of this very early on. But in a sense, the third isn't just that ability to synchronize among three people. The third is already present in the dyad because you and I are now creating a pattern.
Yeah.
And the pattern becomes the third. Yeah. So the patterns of communicative action are, shall we say, the building blocks of human relationship. Yeah. And those building blocks require or imply recognition. And to the degree that there are good patterns of recognition, we are able, or to the degree that we can repair some break in that pattern of recognition where there is, shall we say, misunderstanding, misalignment, not lack of fittedness, we repair that. We start to match again, to synchronize again. So we go in and out of synchrony.
Yeah.
Which is to say, in a sense, we go in and out of recognition.
Yeah.
Now, when we create those patterns, and then we have the meta pattern of rupture and repair, we're building what I call the rhythmic third, which is a more general schema in the mind, shall we say, or position in the mind, where I understand how to be in a flow of mutual accommodation with the other.
Yeah. How would you describe the third and the one? What's the word for that?
So then the third and the one, the differentiating third, relates more to the element whereby we actually hold those two different positions at the same time. For instance, hold the position of the mother, holds the position of both feeling the baby's pain and knowing that the baby's pain is ephemeral and will be soothed. So the mother's empathic response to the baby's pain is not the response of agitation, anxiety, and full-on distress. I always say, if your baby falls off the changing table, the shout that you give is not the sound that you make when you're, pinching your child with the snap and they start to fuss.
Yeah. I think for our listeners, you're redefining those one and the third and the one are very helpful, and they are referred to as one and the third and the one. But to the listener, the one and the third is this rhythmic third, and the third and the one is the differentiating third.
In my book, I use those latter terms because they seem to be more.
Yeah. I think they're more identifiable. You can identify with it more. A sidebar, I don't know if it's a sidebar. One of the things that I think that I appreciate about your work is I think we can misunderstand the rhythmic third and get stuck in it, because the differentiating third is what it's being able to live in the tension of difference is so powerful, and I think is what is transformative. And I think psychoanalysis and psychotherapy in general always defaults to empathy, if you will, or being in sync with one another, and are scared to be the other that is not that, or to address it. Would you agree with that?
Well, that's a fairly recent problem, Roy. It used to be the other way around. So, it used to be that the analyst was always trying to be differentiated, and that the analyst was always interpreting from this position of slight distance and what we call the third in your own mind. And the analyst was, and it was for this reason that Lou did this wonderful analysis of what Britton described, where the patient comes to be able to accept what Britton is giving back to them. Now, in the past, what you gave back to the patient was supposed to be accurate, not empathic.
Yeah, there you go.
And they could just, live with it and struggle with it. And if they couldn't do well with it, then they were borderline and goodbye.
Right.
So we then began to understand affect regulation. We began to understand the need for empathy. We began to understand that the ability to simultaneously soothe someone and show your empathy gesturally, procedurally, right, at the same time that you are telling them something that might be more difficult to hear or put together, was kind of the balance that we're looking for. At some moments, we're just going to be doing affect regulation. We're just going to be empathic. At some moments, we might get caught up more in the aspect of differentiation. For instance, I know you don't like this idea, but this seems to me to be one of those things we've talked about in the past.
Right.
Where you're the one being reactive with your partner.
Yeah, right. Yeah.
Maybe we could look at that. I understand why you got mad, but this is on you. So, maybe we can. So we have the ability also to be playful. We have the ability to indicate that we're not judging the person. All of that is procedural and rhythmic. And as we do that, we're also trying to introduce, shall we say, that differentiating element of where we were and where we would like to move to, for instance.
Yeah.
So that's one element. Where have we been coming from, which was painful or even traumatic, and where would we like to go to is already a differentiating idea, right? So we're going from the then to the now and into the future. That's already differentiated.
Yeah.
But the analyst is also charged with both understanding the person's distress and intuitively understanding where they need to go with that distress.
Mm-hmm.
So the analyst is having to be differentiated, shall we say, even when being empathic. Now, what I like is that Lou has a lot of emphasis on differentiation, more than me.
Mm-hmm.
But on the other side, what I'll say I emphasize is that even while we're differentiating, we need to have feeling. So I emphasized in my most recent book that we need to have the music as well as the lyrics, and that there's a kind of a decoupling of music and lyrics. That is to say, when we decouple the rhythmic element of matching and synchronizing from the differentiating element of not just observing, but also holding tension between opposing feelings. When we split those apart, that's when we're in trouble.
Yeah.
So,
and also where there's opportunity.
Lou and I are a good complement to each other,
Right. There you go. Yeah. Let's use his idea that he says of the third that he's written in this essay. He says the idea of the third is a means to conceptualize reflection and symbolization. The third, he says, is an effort to create a psychic space within which to think together about ways in which patient and analyst are similar and different. That's that rhythmic and that differentiating third, I think. Merged and separate, identified and differentiated. A place where they're able to achieve a third position beyond the transference, countertransference interlock, and beyond binary thinking into transitional symbolic space of thirdness and intersubjectivity. And I think that captures it fairly well.
Well, I think at the same time, though, that you can see that there's a heavier emphasis on thinking.
Yeah.
Okay, so for me,
I hadn't thought about that, but good point.
The expressive emotional element is just as central, if not more so. I really believe that, not only is affect regulation central, but as the affect regulation people have described, like Siegel or Shore or Fosha, those people, their work has shown that emotions are actually integrating and create coherence.
Yep.
So when we are able to move from the state of hyperarousal into a more formulated emotion like, oh, this was sad, this was painful, this hurt my feelings. When we're able to do that, we become coherent, cohesive, I should say, right? So that cohesiveness, which is also emphasized by self-psychology, that cohesiveness requires not just a intellectual formulation of the emotion, but in a sense, the ability to contact the emotion. When people remain in the state of hyperarousal and reflect on what they are doing, they can produce very good narrations. And then it's quite disappointing to them or to us that nothing changes. So there comes this moment when we actually can see someone, as I would put, drop down into the feeling, and at the same time stay in touch with the narration or stay in touch with the symbolization, right?
Yeah. Well,
And
and you know,
that ability, developing that capacity, that's very much what we're talking about.
yeah, yeah. Oh, I love that you introduced the affect, because even when there's another way to think about it, the feeling is what will be the change agent, if you will. How do I hold on to a feeling while still going, okay, I can see that, but I still feel this. And it's those two that come together that I think is a process. Like even rupture and repair to me is always like, well, that sounds so simple and quick, but it's actually a long process, right? Of holding on to feeling while also trying to have a mind about the feeling.
Right. And so when we're like, when we're dealing with, say, a toddler,
Mm-hmm.
we in effect can say to the toddler, I know you like to stay in that warm poopy diaper, I like you.
Right.
I know you don't like me to take this off.
Right.
Right. I know that air feels cold and you're annoyed with me. And at the same time, I really do have to do this. So
Right.
a lot of what's going on in socialization, hopefully, is creating that experience of the mother being able to hold what she has to do and what you need to do in conjunction with, but I don't like that.
Right.
I don't want to.
Right.
It seems to be able to empathize with that. So for me, a lot of what we're doing in therapy is a translation into adulthood of this basic move of like, I know you don't like that, but you have to do it.
Right.
So we're trying to in a sense, have shall we say, a replication of at an adult level of a much earlier experience that people are missing, of an adult being with them and soothing them and caring about them, who can also think about what needs to happen and what's best for them. And so they don't have to be anxious about who's minding the store.
Yeah.
And that's what goes back to the big idea that I started with in my work of Winnicott's idea of surviving destruction.
Yeah. This brings me back to something I said a moment ago, but the way that I feel in my work in supervision and that sort of thing is that often the therapist is unable to bear the baby's desire to stay in the dirty diaper.
Yeah.
And so the patient wins over the therapist to leave them in a state of babiness, if you will, and getting their way, as opposed to, we have to do this in order for.
But you're right, Roy, because you did mention this, and you were actually pushing me to go to that a moment ago, because you were saying people overemphasize empathy and synchrony in the rhythmic third. And I absolutely agree with you that for the last however many years that I've been doing supervision, I very often find that this is what is happening, and that what we used to call merger is preventing that lack of differentiation, preventing forward movement, because, and this I have to introduce here, there's fear of harming. There is fear of harming. This is an underlying fear. So when Lou was talking about how we don't want the third to be intrusive, we're not trying to impose an interpretation. What we're talking about is impingement. And at a deeper level, we're talking about the fantasy that I can disrupt you and destabilize you and harm you by telling you something about yourself from the outside that will be shaming.
Mm-hmm.
That will be shaming. And so now, in order not to shame you or not to make you feel guilty, I'm going to avoid touching that hot spot.
Yeah. Yeah.
And that's the analyst's own fear of harming, that then that's what syncs up.
Yeah.
What syncs up is my fear of harming and your fear of harming. And now we are imagining that we're avoiding the doer and done to.
Yeah. Right. Yeah.
What we're doing, however, is in a sense dissociating, pushing the doer and done to away from us. Yeah. And then it will come back to bite us.
Yeah. My head is spinning right now with so many patients where we've been in this interlock, and I'm going, oh my God, it has to be said, but how will it be said? And in part, taking the risk to say it and hoping to God that this person will also be able to join us in reflecting upon this intensity.
Well, in that sense, the God that we are praying to is the God that gives us the grace of being able to stay as connected as possible to the person's pain or shame while we're thinking. So to the degree that we can do that, we're more likely to say it in, a way that feels like we're joining them.
Yes, exactly. Oh, that's good.
That wonderful illustration of how he wants the supervisee to join the patient in the exhilaration about the power and violence, and at the same time be aware of how horrifying it is. Now, at a certain moment, we're not going to. Okay, can I just riff on Lou's example for just one more moment? Is that okay?
Yeah.
So the thing in Lou's example is he wants the patient to be able to express this exhilaration, this very, shall we say, frowned upon identification with the terrorists that the supervisee is alienated by. However, initially, you have to be able to join the patient in that. You can't be saying to the patient, I want you to keep this horror in mind while you're enjoying that. You can't. Okay, the patient is now actually in a do or done to relation with you where they're feeling defiant. Like a patient recently said to me, I hate my brother. And she's being defiant. And I don't care. I'm not remorseful. Right? So in a sense, our first position is to have acceptance. Okay, I'm not going to judge you or shame you for having that feeling. Your second position is, in a way, you're saying, I'd like you to be able to look at that feeling. That move, I'd like you to be able to look at that feeling, is in a certain sense wrong. That's where you're praying for the wrong thing, and be careful what you wish for, because the problem is, and Lou is showing us this, we have to work through our own binary. Otherwise, we are very impatient to get the patient to the point where they will not enjoy this power and violence anymore. We're really in a hurry to get them out of that, as opposed to finding a way to join them. And this is where play comes in, which I know you were going to ask me about. Finding a way to join them that suggests that there is still a sense of separation or differentiation in regard to that feeling. So if you said, sometimes it can feel really great to have that power and know that you are not going to be the one who is made helpless. You are not the one who's going to be shamed and hurt. Your dignity is not the one that's going to be trampled on. And that's a great feeling. And you can identify with even colonized people who do that. The only thing is, when you're doing that, you're forgetting, in a sense, or not looking at, which we all do, because we do this in the movies. We're not really experiencing in that moment the position of the other person who's being blown up. In reality, what we feel is that the only way we can enjoy this is if we just pretend that it's like a movie and nobody's getting hurt. But when a kid looks at one of these things, they see a movie, let alone something on the news, they're totally freaked out. My kid was running around shooting guns at people, and his friends, playing all these shoot 'em up games. And then when he accidentally, because I hadn't turned the TV off fast enough, saw somebody being harmed, about to be shot, and a newsreel, he totally freaked out. Right? So how we negotiate that is actually so much more complex. And yet, Lou's advice to the supervisee is not wrong. It's just, now how do I actually do this? I was hoping he was going to tell me. Now, how do I actually talk to the patient about how they could be exhilarated at one moment and not at another?
Well, I think the key word that you brought here is that there has to, because the other part is that a person can be very irresponsible with what we say if we are not attuned and joined with the patient's agony, if you will, their trauma, their story. And I think we have the one problem perhaps of being too cautious, and then we have the other of not being thinking. And I'm just going to say whatever I want. And I think what you're getting at is, unless the patient feels some sense that what I'm bringing you is really on our behalf and on your behalf, then it's going to create just another interlock, a big collision, if you will, other than a collaboration. Yeah.
So the solution that came to my mind with this patient with 9/11
In the book.
Yes, that Lou presented, was that you would need to say to the patient, I know that you have a need to really enjoy this power and to feel some exhilaration of that finally somebody's expressing that violence inside you. But part of why you have that need is because you've been very frightened of ever showing those feelings. And you were, in a sense, forbidden or punished even for showing your need to be angry or have power. And so it's a relief to see those feelings expressed. And in that moment, you're forgetting that in reality, you were very frightened about those feelings. You were made to feel frightened about those feelings. And of course, in real life, if we act on those feelings, they are horrific, but you were actually scared to show those kinds of feelings in much more minor situations where you weren't really going to hurt somebody.
Right.
And you came to feel that you were a destructive person. I mean, not to say we can say all this at once, but that's what's behind it. And you came to feel you were destructive. And now it's like damn, it's a relief to see those people get away with this.
Yeah.
But in reality, the person is carrying all this fear of being destructive.
What I saw Lou doing in that case supervision in the chapter was encouraging the supervisee to open up to other aspects of herself in order for her to see the other aspects of her patient.
Yeah. And that was the differentiating element.
Yeah.
Was open up to something different, that radical openness.
Yeah.
And where I went, it's interesting when you say this, because where I went was sort of almost like, well, how am I going to solve this problem? The fact that the patient has these dissociated experiences and feelings that are behind this, which if I were then talking to the supervisee, I'd be jumping ahead to that. Lou is making a move that, in a sense, we could say is a procedural move.
Yeah.
It has to do with the geometry, the beautiful geometry of what he's presenting, which is first, let's open up.
Yep.
So in working clinically, in some ways, although I'm stressing affect, Lou is stressing openness.
Yeah.
And what I've discovered in myself, and it can be problematic, is my version of what you were talking about before, which is I want to find out where's the affect. I want to synchronize with it. I want to use that to downregulate the person, to soothe them. But am I actually working with myself?
Right.
In that way? Am I questioning the fact that I'm going to dive right into this? Am I being open, for instance, to the patient's resistance or shame?
Right.
Not necessarily.
Right. Exactly.
So it's really, it's very multifaceted here.
Yes. Well, one of the things that I so appreciate about the relational movement in that, and one of the things that I actually am teaching a lot now, and what I felt Lou did get into this chapter on, is this: in order for us to be radically open to our patients, we have to be radically open to ourselves. And so in that particular case, I felt like he helped the supervisee imagine many more parts of herself that were operating that she had dissociated. And then he also says, I caught myself rigidly identifying with one aspect of the story, and I disidentifying with the part that I didn't like, right? And I know that seems common to me, is that I'd rather just identify with what I know and what I want rather than those things that I'm not there. Which brings me to this, a couple of things, but our time is
Except
running.
one thing, Roy, you could be doing what I was describing before, which is pushing yourself to identify with the other part, but not really entering the state of openness, which is different.
Yeah.
Right.
Yeah. So I want you to say something about mutual recognition, but in this particular thing, we're kind of going into how do we speak to our patient in a way. And one of the things that's always a little interesting to me is this idea of personal disclosure. And a long time ago, I realized my patients weren't that interested in my life with all of my disclosures. And that really the relational movement is we're always trying to work. What is going on here anyway? What is happening in the in-between? And that I find myself disclosing, if you will, or articulating that which is happening within between. And I wonder what your thoughts are about that.
Oh, yeah. I mean, I think that's where reading Lou is always sort of, shall we say, helping you to re-stimulate and remind yourself of some of these basic moves. For instance, what Bolus called the dialectics of difference, which I know influenced me early on, and then I sort of forgot about where that came from, but it really did come from Bolus and Hoffman in particular, this idea of sort of disagreeing with yourself, of saying that you're of two minds, of modeling for the patient the way that you're thinking about this. And one of the things that I like to do when I'm working in that way is I like to go back and say, well, you said this, and I said, you said this, and I said that. And, now I'm looking at what I said, and I can see where that didn't really fit with what you were saying. But I also see why I said that, which is it was going toward here. And now, so you're going toward here, I'm going toward here. Let's make something of that. So I'll invite them to actually, take the overview of the whole interaction sometimes.
And I'm thinking just how rich that is to let our patients in on our minds about them and about us. Whereas in the Britain case that is in the book, it is our minds are housed within our own mind, and it doesn't allow the patient to get a mind from another mind.
Right. And, I think that the other piece of that has to do with the degree to which people are raised in, shall we say, more or less authoritarian settings, where they are more or less allowed to comment on the adults, to tell the adult, to say, but Daddy, you said this other thing, and now you're saying this. And obviously in certain cultures, that's punishable offense. Whereas in others, it's welcomed as an opportunity. So when you're working with people who've grown up in relatively repressive cultures, for them to be able to comment on your mind is a big deal. And we have to stay, in a sense, aware of that, not only because we want them to be able to do this. But here's the other thing. Like, I have worked for a long time with somebody who suffered abuse, and the big issue for her was telling. She was never allowed to tell. She never told anyone until she came into treatment. Now, that telling fills her with enormous anxiety. And for me, I would be imagining, let's say, that it would be a relief. She's trying to tell me, no, this is terrifying for me. And so she'll say to me, you think this is going to relieve me, but after I leave this session, I'm going to be terrified that I told you. Right? So she's already become capable of thinking about the difference between my mind and her mind. She's got the whole picture there. But at the same time, she hasn't stopped being terrified. And she tells. And that is the other piece of what we're still struggling with, I think.
Yeah. Yeah. We're running out of time, Jessica, and I would like for you to just what would be the last words that you might want to leave with me and our listeners today. And it's just been wonderful to be with you and to talk through these things and represent our friend Lou as well in this process. So thank you. But what would you like to leave with us?
My last words, aside from thanking you for this opportunity to think with you and go back and think with Lou and think about how he saw things, is that the most exciting thing I think about our field and about relational work is the way that the movement never stops, that you can keep it. I was saying something, I might have written this to you, about how Lou could take a certain idea, like say he's using my idea of complementarity, but then he just elaborates it so that it's a whole new fractal. And the new fractal has all of these shapes in common with the old fractal, but it is also adding all of this and creating yet another shape. And I feel like this fractal way of expanding I think relational theory has opened up.
Well, what I want to say to that before you go on is, and your generativity to see that your idea can also be talked about and expanded, and you don't hold to it as a rigid idea. That says a lot about you, but it also says what this whole movement is about. How do we expand our thoughts about these?
Yeah, and sometimes you have to repress the impulse when you're like with students or whatever, and somebody comes up with one of those fractals, and you have to repress this little voice inside you that says, "But wait a minute."
I know, right?
Yeah, wait a minute. I don't want you to have an idea that I didn't already have.
Exactly.
That's the pain. They're actually having an idea that you didn't have yet.
Right.
That's this little narcissistic injury sting that you're going to have to feel in order to allow this process to continue.
Exactly.
So there's this ongoing narcissistic challenge, to our omniscience and everything else that we're sort of always going to be involved with, aren't we?
Yeah, exactly. Yeah. But it's so rich when we can somehow surrender, I think is the word, to,
thank you. Can I please add that? That was the thing I was going to say, that the big difference might have been between me and Lou, that I was starting out with this idea of surrender and the acceptance of what is. And so when talking about that case of Britten's, for example, part of the thing that came up was that Britten later wrote that how we avoid doing this kind of intrusive interpreting imposition of the third is we realize that we are doing something that we didn't know we were doing. And it's that act of surrendering to knowing you were doing something you wish you hadn't been doing because it wasn't good. That surrender to what is, whatever form. That really is in a sense, the energy.
Yeah.
Right. The energy behind the third is that surrender. Right.
And I think, exactly. And when we were talking about what we might say to our patients, et cetera, if we offer our thought and our contrasting thought as authority, then it's going to be disastrous, I think, and harmful, frankly. But if we offer it in, I think, I'm wondering, I'm surrendering this into the space so that we can play with this idea, then we're in a really wonderful, potentially transformative space, I believe.
Yes, and the more that we're able to, shall we say, reap the benefit of enjoying that and enjoying the play space, right?
Yeah.
The more we can give up that attachment, that to need to feed our narcissism, need to be right.
Yes. Yeah. That's right. Oh my goodness. Well, thank you so much. It's such a joy to be with you again and to play out thoughts and to hear your wonderful mind. And thank you for your time today.
Well, thank you, Roy, for giving me this opportunity to share thoughts with you, but also to sort of make Lou present with us again. That's a really wonderful thing to do. Thank you.
It is. Yes. Well, thank you. Take care.
Take care.